Welcome to the latest Medcan Presents webinar. This is back to school medical advice for parents with Medcan pediatrician, Dr. Arnold Jacob. Dr. Arnold Jacob is a senior medical consultant and pediatrician with Medcan. Dr. Jacob obtained his medical degree and completed his pediatrics residency and pediatric hematology oncology fellowship at the University of Toronto. His research interests have been in sickle cell disease and leukemia. Dr. Jacob practices as a community-based consulting pediatrician and pediatric hematologist. Dr. Jacob, how are you?
I'm good. How are you?
I'm great. We were just talking about whether we have our own school-aged children. So I have 3 kids, each of which are in various levels. I have one going into grade 1, one going into grade 7, and one going into grade 9. And you, why don't you tell me about your children?
Great. I have 2 children. One is 3 and currently in daycare. The other just turned 5 and will be going into SK and is currently in daycare.
And is currently in daycare. So
in daycare in between for a few weeks before school. Yes.
So lots of anxiety, I think, about this topic, lots of conversation, lots of questions. So I think we should probably just get into it. Folks, before we do, let me just point out that we will be taking questions at the end. And to ask a question, so you feel free to ask a question anytime through the webinar. And to do that, press the Q&A button at the bottom right there. And we will try to get to that. We try to limit these webinars to 30 minutes, but we'll try to get to as many questions as we can within the allotted time. So Dr. Jacob, why don't you start why don't you share your screen and we can start your presentation whenever you're ready.
All right. Let me just pull this up. And share screen.
And I should point out, this is the first time that we've had lots of doctors do lots of presentations, and it's the first time that we've had a doctor do a presentation from an examining room. And so this makes it feel much more authentic. So this is great. Okay, go ahead. And I'm just gonna stop I'm gonna mute my audio.
Okay, well, thank you so much for giving me this opportunity to talk about a topic that has certainly been on a lot of people's minds, myself included, and has dominated recent discussions in clinic. All right, so essentially all of this boils down to, well, not all of it, but a big chunk of the discussion boils down to, should I send my child back to school or daycare? And I would say that ultimately each family still has to make their decision. Of course, there are lots of other stakeholders involved in ensuring that it's safe and that things are ready to go. But one of the great starting points would be assessing your needs. And when I say your needs, so the needs of the child and the needs of the family. So we acknowledge that certainly schools are much more than just classrooms. There are a number of articles which I will, point out as we go along. I've left a few probably easier reads and more potent reads in, so that families can, certainly on their own time explore a little bit more widely. I would say to start off in acknowledging the needs of the child. Of course, the school represents much more than just the education, academic elements of things, but for a number of children also represents respite from sometimes troubling situations at home, play and interaction with others, and development of social skills, the ability to, have recreation, and in, particularly kids with particular special needs, an opportunity to have therapies and services provided. As we think about this a little bit more widely, it also represents an opportunity for families and for adults to be productive and to contribute to society and provide for their children, as I would expect many of you all would recognize what this is from. So in searching the literature, very fortunately, we're at a point, probably because of the timing, that there have been varying iterations of documents put forward by major journals and societies and hospitals and governments, as you can see here. I've just put a few spatterings that probably be a little bit relevant to a particular geographical context that offer some ideas and guidance. We've also had the opportunity, though not many studies, but to benefit from a few studies. And particularly, I think this is one that probably be on most people's lips if they've been paying attention to the literature because of its recency and completeness. So this was just published August 5th, if I could recall. And it was about a prospective study on the transmission of SARS-CoV-2 or COVID-19 in Australia and New South Wales. So this looked at 25 educational settings, and within those 25 educational settings, it was from January 25th to April 10th. So still relatively early in the pandemic and shortly after the first confirmed case who had moved to that particular geographical region from Wuhan. In the 25 educational settings, they were able to pick up that 15 of the schools actually had children or adults who attended school whilst infectious, and they did contact tracing and testing, where they had about 43% of the contacts actually tested, and they picked up 18 secondary cases. Interestingly, and this we'll circle back to this a bit later on, there were 10 early childhood education settings where 9 had no transmission at all, despite having cases, except 1 did have an outbreak with an attack rate of about 35%. So, looking at this in terms of risks, worldwide rates for COVID in pediatrics have been reported kind of the 5 to 10% rate. Canada is hitting in there somewhere solidly in the middle, around 7.5%. There's a busy graphic I have on the side here, but an important one just for some content material that I'll circle back to later. In terms of asymptomatic cases, you have maybe about 15 to 16% asymptomatic cases in a lot of the studies. And interestingly, even in the people who are symptomatic, you may have as high as 59% with no fever. So circling back to inherent known underlying medical condition risks from the CDC and certainly in the adult population, I won't spend too much time here because a lot of this refers to the adult literature. It is freely available on the CDC, and there's a link I've provided a bit later on that you could circle back to it. But certainly chronic medical conditions, cancer, chronic kidney disease, major respiratory disease, immunocompromised state, obesity, serious heart conditions, cardiovascular disease, sickle cell disease, and type 2 diabetes. They go forward to say that there are some that might pose increased risk, including severe or moderate asthma, other cerebrovascular disease, cystic fibrosis, hypertension, neurologic conditions, liver disease, pregnancy, pulmonary fibrosis, and smoking. Now, peeking in on a document that I alluded to a little bit earlier from SickKids, based on expert opinion as well, we presume that immunocompromised state, chronic medical conditions, particularly cardiovascular, respiratory, neurologic, developmental disabilities, may pose increased risk. Now, you have to bear with us that at this point, when the pandemic kind of came on. So in Wuhan at that point, a number of people were still on holiday or away from school. And in a number of the other regions in the world, schools were closed relatively early or at least put in place risk mitigation strategies. So as time goes on, certainly we'll see a more complete picture unfold in terms of other conditions that might be considered to increase your risk. Okay, so I'd say one of the things that we should keep in mind in the consideration of whether or not to send our child to school would be, of course, rates of disease. So rates of disease in the population, whether that be national, or, regional, provincial, and then certainly neighborhoods. There's a graphic that I have here on the right, which is again freely available from Public Health and through City of Toronto website, where you can see in semi-real time the rates of or the number of cases per 100,000, and there are many different metrics you could look at in the Toronto area, and you see that there is some disproportionate disproportionately affected regions, but something to consider somewhat for parents, but also for lawmakers, for schools, to design and put in place strategies to try to mitigate risk, particularly in areas that have higher incidence. Right. Again, as I a little while ago alluded to, we should be a little bit wary that the asymptomatic rate in PCR confirmed COVID-19 cases in pediatrics has come out to be about 16%. I would say anecdotally, without being able to give exact numbers, I know that that is way lower than we'd expect in the community, owing to I could think about in my own practice that a number of families, almost everybody in the immediate circle has it, and they have a child who may have developmental concerns or is quite young and, remains relatively speaking well. And, without the current, presence of, treatment for, early disease, they didn't really see the point in testing. Now, testing, of course, is helpful for us to make some plans on a society level, but you'd understand that there's a number of children who would just not have been tested. And if you consider even the testing characteristics and how it must be done, some children have been tested, but possibly false negatives. Okay. We'd have to consider the school environment and infrastructure. Now, the varying ministries have a challenging task ahead of them to figure out, well, how do we, implement and consciously and continuously have iterations of a plan to make sure that we maintain infrastructure whilst at the same time having budgetary concerns. But, I would say for the individual parent, again, you need to be aware of and engaged in what kind of infrastructure you have at your local school, and perhaps engage the ministry, engage other stakeholders in figuring out how to optimize it. Realizing as well that school infrastructure goes well beyond just the classroom, right? So the school infrastructure, of course, extends to play structures, common areas for entryways, regularly touched surfaces. So there are lots of, potential points where you need to consider in terms of the infrastructure that may need to be managed, and that could be areas of risk. This article, or this picture, is from an article in Hamilton, where the bus drivers, again, themselves are concerned with the level of preparation, the level of forethought and involvement going into them and being able to deliver appropriate care for schools. Okay, so it's interesting that the rhetoric and a lot of this discussion has taken place around masks, right? And whether kids should be wearing masks and what type of mask they should be wearing and so on. But I think we should always take a step back and think of, well, what do we really need to do to mitigate exposure risk, period? Certainly, personal protective equipment falls into that schema, but it should not be the only thing around which we have discussion, and it shouldn't be the only place that we spend effort and money, right? So, it's a great read, the Sick Kids Statement on School Reopening. I would anticipate that there'd be lots of different counter viewpoints from different stakeholders, myself included. But amongst the things that they included in their document was, an adaptation of a CDC figure in terms of hierarchy of controls, and then, put in specific recommendations as to how this applies in our particular context. Right, so at the top of it, and amongst the most effective, would be elimination and substitution. And here, meaning screening or exclusion policies to make sure we do not have, sick or potentially sick people coming into the population of students. And below that, engineering controls. So certainly ventilation strategies, physical distancing, cohorting, hand hygiene, and other things that, mitigate these risks. And, considering different ways of delivering our education. So, alternative venues and designs of classrooms, including potentially outdoor. And then amongst the mitigation of risk, then PPE. And then we'll kind of get into this whole mask discussion in a little while. All right, so screening, and certainly the idea of screening, for who may not be familiar, would be to put into place some sort of test, which you hope by its design and iteration and review is more likely to pick up a specific condition than not. It's okay if it picks up other things that are not the condition, but what the better characteristics of a good screening test would mean that you don't really miss positive cases. So in this case, you don't miss people who have COVID, right? We must openly acknowledge that the signs and symptoms are some semi-non-specific, at least certainly when you have one or two, and we will be going into the cough cold season. So what screening looks like at the beginning and what screening looks like at our current state of evidence and our current understanding of disease and complications will probably have to change as time goes along to improve its characteristics. Realizing that when you're doing screening, you also want to find a way to administer it in a way that is equitable, effective, and doesn't inherently create its own problems. And one thing we'll be facing is that in the volumes of people entering schools, it may, depending on how many, how the screening is actually done, it may be a bit prohibitive because the amount of time taken or, choke points with number of people going through one person doing screening or a couple of people doing screening might increase risk, right? And something I'd go back to with screening in terms of physical exam measurements, a number of places have instituted temperature checks, which, I think is still up for debate, but something to consider is that they still may fail to pick up a large number of symptomatic or asymptomatic or pre-symptomatic individuals. So certainly there may be some role and, depending on the particular characteristics of your area for temperature checks, but, they're not the beginning and the end. Right, so here, these graphics are to, again, talk about, ventilation. Certainly the design of, buildings and, schools prior to COVID, in some cases over time have taken into consideration perhaps volumes, not as much, some of these infection disease control measures. So it'll be something that will need to be evaluated on a case-by-case basis. And I think, as a parent, you'll have to be involved or at least aware of what is available at the school, and then whether things can be retrofitted or if there are alternatives to improving ventilation or improving physical distancing. And then we get to the point of PPE, right? And so to be clear, and the graphic on so these show, I guess, kind of, extremes of the range, right? Where we have a hazmat suit on one side and we have a bib on the other. But to illustrate a point, that, we need to at least understand what we have available for PPE, what the purpose is, and then what the effectiveness is to at least, have an informed discussion around whether or not it should be used, right? Now on the left-hand side, I'll just say that this was a healthcare worker, but we know that even things like masks can be, onerous or, cause pinch point injuries or so on, for example, in healthcare workers. And most healthcare workers don't need to be in PPE, for a persisting day. So the question would be, what the expectations would be for a child, but also, how efficacious it will be in terms of their ability to wear it appropriately. Because if you don't, then it doesn't serve the purpose. But really, I think in terms of the discussion and, medical mask, non-medical mask, particularly in, general use, we're talking about source control. So we're talking about the individual protecting others from large droplets, right? So in this case, I would say, if anything, in the context of schools and, non-medical environments, the use of, the non-medical masks would be to protect others from you, right? And again, only if worn appropriately. Now, in terms of what materials and comfort level and all of that, those things will perhaps play a role in terms of whether or not somebody would actually use it, right? But, will be important metrics to consider for a family. And as I talk about effectiveness, I mean, there are things that you can do, and you're seeing my pointer, right? Christopher? Okay, yes, so there, there are, oops. All right. Right. So, there are some things that unfortunately have been unmasked as pet peeves for myself. So, I like to refer to one as the chin mask, right? Also called the beard mask. But also in this picture here, you can see the glove phone, right? So those are ways not to wear PPE. Because in effect, if you had been using your gloves here to clean up after your dog, you've now put it right next to your face. So you need to consider, in terms of use of PPE, that there are some potentials for actually increasing risk of exposures where you use things inappropriately and don't realize the risks, right? There are some ingenious kind of strategies towards ways of perhaps improving the currently available PPE, and certainly there, as COVID has unfolded, new companies have found creative ways to kind of get around some of the issues regarding being covered and so on. So I guess we'll all have to keep, peeled for, what is to come in terms of availability of resources. Right? Then of course, mitigating risks. So cleaning, and then what surfaces, what particular, what frequency, what particular materials used for cleaning, if there are any implications on the air quality and health, potential to trigger, conditions in children that needs to be considered, children and, teachers and stakeholders that needs to be considered. All right, so I'd like to say in terms of, balance and recommendations on return to school, certainly I stand with the Canadian Pediatric Society on, a safe return to school for kids. Certainly there are many benefits of school, not just to the individual child, but to the family, to society, on a whole. I didn't go into all of the nuances of the rates of transmission, but there is some evidence that suggests that in the under 10-year-old kids, that there actually might be a lower carrier rate and a less effective or a less efficient transmission of virus. So that, certainly has to factor in. Whereas in the 10 to 14 and high schoolers, it's been shown in recent studies, very fresh off the press, that they may be as effective at transmitting. What you may not get is you may not get the same severity of disease as at the extremities of age, and certainly the above 65s. So I'd say that as we move into these phases and these stages, and we are considering reopening and restarting schools, that we need to have a multi-point iterative policy development with the stakeholders, right? Needs to be involving teachers and school administrators, certainly parents and children, where developmentally available or able, certainly experts in child and adolescent development, public health and ID specialists, pediatricians, provincial and territorial medical associations, the childcare centers, psychologists, physiotherapists, occupational therapists, all of the stakeholders. Because to be honest, I think we probably only get a couple shots at doing this right. Okay. And I think amongst it all, of course, the issue is political, right? Because we're talking about, a large, proportion of the population, and then with inherent, potential risks to, other silos in the population, right? But certainly the ministries need to be involved to make sure that there are resources, that there's infrastructure, there's equipment, there's policies to support teachers, administrators, everyone in the chain. And as we go forth, into, this kind of time of uncertainty, the decisions need to continuously be reassessed and balance public health risks, with the harms of social isolation and needs of children, right? I would say that, I am a little bit more risk averse, and I, was a little bit more, well, maybe we should hold off. But, the weight of the evidence suggests that there potentially is a way that we can do this. And, certainly we can find iterative ways to mitigate risk and to, control local outbreaks, right? I think, part of the challenge is how quickly we'll have to come up with locally developed programs and locally developed structures, because really it will be regionally dependent, and there are unique characteristics of each, of each school layout, of the particular personnel, of, particular emphasis of a school. And we should expect that, as things open up and as that, kids go out, that there may be outbreaks, right? Or we that would be a reasonable expectation. And it's very possible, very likely that it will vary significantly between school districts. So we should make sure that we have risk mitigation strategies, as well as, like a plan, a prospective plan between the schools, between the regions, so that we don't unnecessarily put kids at risk, right? Both from the health aspect from COVID-19, but at the same time from isolation and lack of structure and support, right? Certainly, out of perhaps the frame and the scope of this talk, vaccines, serology testing, other risk mitigation strategies will become, available down the line. We're not quite sure, which things will be ready for mainstay and, how the uptake will be amongst the population. So at least we need to have, some plans in place that, independent of those, but also, with those as a contingency, but hopefully giving us an opportunity for improving safety. Right, so I thought, as a parent as well, you'd want to know, well, what could you do to actually optimize your kids' health if you're going out to school? Certainly if you have if your child has a medical condition, you optimize and seek advice from a primary care practitioner and specialist as necessary. For the children whom, we will be using PPE, we'd perhaps want to trial and optimize your PPE, prior. Certainly, certain designs of masks and other things create pinch points, and you don't really want to discover hour 6 into day 1 that this is something you could have identified and mitigated prior, right? Also be very aware and certainly beware of the risks of adopting unproven treatments. Certainly this is a time that, we're no longer in silos. All over the world, we're facing this thing together. And there's a lot of information sharing on an unprecedented scale, right? So beware, some people unfortunately will, and I can't say, I can't speak to motivations, but we'll talk about things that are unproven, and it certainly might increase your risk for complications of unproven treatments, or some false sense of security, right? So make sure to listen to trusted sources, pay close attention to alerts and news. Certainly, a bit of a challenge, even in making this presentation, is that, you make one version of it, and before you even have an opportunity to complete it, things change, right? So my 5-year-old is going out to senior kindergarten, and up until last week, whilst I was off for a few days, I was, wondering what was going to go on in terms of, class sizes and so on in that age, realizing that their uptake and their efficacy use of PPE is not great. And, certainly there were petitions that were circulating, and then suddenly Friday night, something changes. So even from the end of last week to this week. And here I put up a few sources. I mean, certainly there's a lot more content within the presentation, but I felt that these were very helpful things at various points in kind of looking at it, and at least some good sources to understand. So here I put up one from the Washington Post, just regarding, spread of infections and different modeling for if you, control different size groups. And on top, so I mean, you can follow that to varying extents at toronto.ca.home /home COVID, where you can find different metrics to inform yourself. There are varying different articles. I would say that the New England Journal and the Lancet have made their COVID content freely available, so you do not need a subscription. You can read the stuff that we read. And then Sick Kids has, policy statements. They had one earlier version and a more recent one from July 29th that are also freely available. And here's the link. All right.
Fantastic. Thanks so much, Dr. Jacob. I'm just going to take you off of your sharing. Okay, great.
Okay.
So we do have some questions. Before we get to those questions, I just want to, are you sending your 5-year-old to school? Have you made a decision there?
I am. Again, it was, initially one of the more polarizing decisions, because we were like, well, we don't want to, of course, the issue goes well beyond, the immediate family, right? So we're talking about vulnerable, in-laws and grandparents and so on involved, and we don't want to risk them. So, something I didn't discuss here, but certainly, a little bit outside of the scope, but you'd have to institute risk mitigation strategies within your household and within your local bubble, right? But yes, we are. So we are sending, our 5-year-old out to senior kindergarten. We are sending our 3-year-old to daycare. My wife and I remain very engaged with them for a number of, the administration and the teachers, and of course we're keeping our ears to the news and reading literature. But I think right now the volume of evidence suggests that, it is a reasonable thing to do at this point. Things certainly, will change. There will be local changes and so on, but that is our plan.
Fantastic. Okay. Okay, I'm gonna launch into the questions. So I am a grandmother raising my teenage grandchild. I have a compromised immune system. Do you have any advice?
Right. So certainly amongst teenagers, so a few, I guess, in terms of that person and risk. So they carry a very reasonable load in terms of viral load. So their ability to transmit is considered to be almost as effective or as effective as adults, as compared to the younger kids. So that's one thing. However, for the most part, should be developmentally able to wear appropriate PPE and to follow, guidelines around that. I would say within the infrastructure in your household, I'd say that's challenging. That certainly, as if you do have an immunocompromised state, you probably should really seek counsel from your physicians to figure out what you can do to mitigate risks. I would say that your threshold and your likelihood to maybe want to do more distance learning or institute other risk mitigation strategies, of course should be a bit higher. You should, but it ultimately still boils down to a personal decision, right? I would say, yeah, it's a tough spot. It's a very tough spot. I know there will be a lot of families who face something very similar. Even depending on what the needs of your teenager are, it really shifts your balance a little bit, right? I will say it is a tough spot. I couldn't answer the question for you, but it is a tough spot.
To a certain extent, I think, so your suggestion is to seek the advice of your general practitioner who may know better the immunocompromised, like what the nature of the compromised immune system.
Yes.
What about masks for, there's the threshold for masks, and then some school boards are strongly suggesting that kids underneath the certain threshold are wearing masks. What are you suggesting? Should everyone wear masks, or is it fine for 6 and 7 and 8-year-olds not to wear masks? Do you have any guidance on that front?
So in terms of the evidence, and again, the point in the masks, and certainly the non-medical masks in a non-medical setting, would be source control, right? So mitigating the risk of an infected individual. So let's say I'm infected, wearing a non-medical mask will reduce the size of droplets that are able to be dispersed in talking, coughing, sneezing, and so on. It turns out that it's a really divisive topic, even amongst the experts. I would say that, certainly if you're developmentally capable of doing so, you have no inherent medical conditions that, bring about compromise, that we should encourage mask use, particularly in closed settings and in older children who are effective transmitters. In the younger ones, I think, it should be encouraged. The challenge, as you could well imagine, if we have a class size of 15 with 2 teachers and, a few kids are like 1 or 2 hours into this and they're done, is that they end up doing interesting things like taking them off, switching masks, masks that may be contaminated, may be found, in random places. So we need to be cognizant of, what our intention is with the mask, and then what is the likely efficacy of its use. So I'd say where possible and where able to be used and disposed of where necessary in a very practical, a more consistent way, then sure. But I'd say that, if you consider that hierarchy of things again, perhaps, other risk mitigation strategies should be used in, younger kids or in people who are not as able to, adhere to certain types of PPE effectively. So certainly distancing and considering, kind of non-conventional areas for delivering education in open spaces or so on, and that will mitigate some of the risks.
One concern with respect to masks is whether the children will actually use them. So with our youngest, we're not requiring him to wear a mask at school, but there are situations where we do require him to wear a mask, which is the grocery store, things like that. And in cases, if you're concerned about your toddler or children wearing a mask, get a cool mask for the child, I would suggest, because we got a kind of a ninja mask for our 6-year-old, and he loves wearing it. Was a problem wearing the surgical kind of blue mask. He wouldn't do that, but now with this ninja mask, he thinks it's the coolest thing in the world. He wears it all the time for fun, actually, when he doesn't need to. Any closing remarks? I know you have to get back to your clinic. Any closing remarks?
Well, I'd say that, we would all have to keep, our eyes and our ears peeled on, how things happen. Now, the reality is that, although I support a reopening of schools, like any intervention, you have to consider that these decisions will come with some risk. Right. Perhaps an easy analogy is if you design and if you're the, involved in hosting a marathon, you have to expect that there will be a number of people who will acquire injuries, perhaps, significant, maybe even death. Right. So I think, when we do this, we need to make sure that we have all of the stakeholders involved, and we need to make sure that we have a kind of consolidated plan, and we leave room for compassion and for, space for hearing one another as this thing evolves. That we're not, unfortunately, we're not talking about a 1 or 2 week thing. We're talking about several months, and we're talking about going into the flu season. And at this point, a number of kids who are already at risk because of developmental concerns, the families are burnt out, right? I see it in clinic. So we need to make sure that we leave, a lot of room open for the dialogue to hear one another out and to be responsive, right? At the same time, I think, the fundamentals of this thing and where we go is that, ultimately how COVID looks over the next, few months is really, only partly based on the virus. It's more based on us. It's based on what we do. It's based on our mitigation strategies. It's based on us, being patient and saying that, look, if we give this time, we could go back to hanging out. We could go back to having parties. We could go back to hugging or shaking hands, right? But if we're impatient and we jump at it now, then we just, we put, our loved ones at risk. We put other ones at risk, and we prolong this thing, right? So ultimately, we have to be individually responsible and to be patient. At the same time, we also need to look out for our mental health. So certainly not just, children I see, but also a number of adults. I can tell that, mental health is suffering a little bit. So I think going into this, we need to continue to tap on resources to check in, to make sure we, keep in contact with our primary care practitioner or specialist or so on to optimize ourselves as we're going into a potentially risky time. Right?
Fantastic. A couple of questions came in right at the end. I'm going to, Dr. Jacob, I'll send these to you, and then okay. And then ideally by the time we can include these in the mail out. So folks, we post these webinars on YouTube, and then we send the link out to everybody who registered. And in that mail out, ideally we could get Dr. Jacob's answer to these 2 questions. I'll just wrap up with, let me just, other resources. So Medcan does do a podcast that posts every Monday morning. A couple of one that may interest people is COVID-19 relationship tips, which was with, the last one was with Dr. Jess of Sex with Dr. Jess. But that's great. It's great relationship tips for You know, anybody who's maybe social distancing and things and having trouble with their you know, spouse or just want to, you know, improve relationships through the course of COVID. Next week's webinar, The Road to the COVID-19 Vaccine. Register for that by going to bit.ly/medcan_vaccine. I think you can see my pointer, but that's right there. That's the link right there. And then youtube.com/medcanlivewell for all of our webinars. Thank you so much, folks. Really appreciate it. And we'll see you next week. Thanks, Dr. Jacob.
No problem. Thank you.
Okay, goodbye.
Goodbye.